Parkinson's disease is characterized by abnormal motor movements, but it's also accompanied by a really bad molecular at the molecular level is also extremely affected, especially at the dopaminergic signaling pathway. But what's interesting is there's also involvement of two receptors, A2A adenosine receptor and dopamine D2 receptor, which are actually present together in a heteromere complex. So the focus was to target these A2A receptors so that it has a synergetic involvement in controlling the dopaminergic signaling. So general treatment strategy involves dopaminergic treatment for Parkinson's disease. However, such treatments are actually, they cause extreme other motor symptoms complexes such as dyskinesia and so on. And we don't know if these drugs have other effects at the molecular level. So I thought, what if I target in an anti-dopaminergic signaling pathway by using another antagonist and check that effect on dopaminergic signaling, and if it has a symptomatic improvement, and also at the molecular level if there's an improvement. So that was the rationale. The idea was to inject the rodent model. I have used rats in this case with 6-hydroxydopamine. It's a neurotoxin that causes Parkinson-like disease symptom in a rodent. And basically this disrupts the dopaminergic signaling pathway. And once there was onset of the disease, I start the treatment. And it's a chronic treatment with the antagonist. And I found a really significant improvement in the motor abilities of the animal. And that was really good compared to the vehicle-treated animals. And also at the molecular level, I actually found a significant decrease in neuroinflammation itself, because Parkinson's disease is also accompanied by neuroinflammation. And this could either be a characteristic to worsen the disease, for example. So if this drug could cause a reduction in neuroinflammation, it's actually a good sign, which is what I found both in my PET scans and also could correlate it well with the postmortem analysis. And further along, actually, I see that it also improves the dopaminergic signaling. So all in all, it's quite a good drug to administer along with dopaminergic drugs that exist currently. Because my PhD thesis is actually involved in focusing on these adenosine A2A receptors and dopaminergic D2 receptors in a neurodegenerative model. So now I find that via A2A signaling, a lot can happen. So probably this drug could then aid in clinical trials, for example, and they could use this as a combination treatment with patients that already have administration of levodopa, for example. So that's probably one of the propositions I have after the study. And also, I may, if I have time, I'm already in my third year now, so I would be checking with another A2A ligand in the Parkinson's disease model system as well. But currently, I'm actually focusing on a brain cancer model. However, that would be, if I have time, I would take this and focus on an A2A ligand again, and probably an exercise model or so.